And so I know for this last question, we were kind of talking about this before we got
Mhm.
started, that it's a big topic, but I did want to bring it up briefly here, and that is breastfeeding with a lip or tongue tie.
Okay.
Yeah.
So this is definitely big controversial topic from pediatricians, dentists, speech therapists, occupational therapists, physical therapists, lactation consultants, because it's kind of like who's right and who's wrong. This was, a natural thing that you have in your mouth that has been there for years, but just kind of like, your earlobe did it really have a function, so I think that, for years, yes, it's there, but it's just part of the anatomy that's there, but they never really correlated to having any function that did anything. So these were the kids that had maybe the lisps, when you were growing up in school, maybe the kids that had gaps between their two front teeth, maybe they had delayed speech, had problems saying different letters or words or whatever, all because of this. And so, over, I would say, the last 10, 15 years, it's research is starting to show, oh, this actually has a purpose versus just being there. And that purpose, can alter functionality of the tongue, the lip, and it causes all these other issues. So if you think if breastfeeding is painful, your baby's not transferring the milk, you're having a lot of issues, and when in doubt, then reach out to somebody in your area that is TOTS trained. So TOTS. It's an acronym for tethered oral tissues. Okay. They have training specifically in lip and tongue tie, buccal ties, that they're going to be definitely more on educated on the topic versus those who might not have it. And we, here in our area, we have those pediatricians that are younger, maybe just out of med school, that they actually learned it in school, where maybe the older doctors were, we didn't learn about that. We didn't learn that, it had any effect. So and you'll see there's tons of social media outlets and things for this, that you'll see all the controversy, and people will be like, it's been there for years. It didn't cause any problems. Why do anything about it now? Well, we have lots of data and lots of research now that shows that it can cause a variety of issues, from bedwetting to ADD to speech issues. So there's this huge gamut. So on our next talk, we will dive deep into that, on what you should do, things that you should look for, who is the right person that you need to be seeing as far as getting some of those questions answered, having somebody actually do an oral assessment to see if the baby has any of those issues. We do have kids that have tongue and lip ties that they function, and their lip does what it's supposed to do and the tongue does what it's supposed to do, and there's not really an issue. So we have to look at, overall the function. Is it physically functioning the way that it's supposed to? So is my tongue doing what it's supposed to for speech and feeding and things like that, as well as my lips for sealing around the breast tissue, around the bottle, growth for when your teeth come in and things like that. So we will definitely get into that, because that is definitely a heated topic. So I want to make sure that we answer all of the questions that a lot of people have, and I can provide you with as much resources as possible to help kind of get some of your questions answered.